To all the viewers who have tuned into this presentation, I, Dr. Chandra Mouli H C, cardiothoracic surgeon, I extend a very warm welcome to all of you and thank you for having evinced keen interest in this presentation. Medical Education Restructuring Curriculum. This is the title of our multi-part, multi-segment, multi-capsule presentation. Every 11th and 12th standard subject curriculum, pre-professional curriculum. I don't know whether there's a word such as pre-professional, but I would like to call it as pre-professional curriculum. 11th and 12th standard students, they get to study those subjects which have a direct relevance, which serve as a meaningful foundation, which have a direct connectivity, and above all, these subjects are the subject curriculum. They find a direct application to the next professional course that the student wishes to join. Example, engineering. Students in 11th and 12th who wish to pursue engineering, they study physics, chemistry, mathematics, computer science, electronics. Students who wish to join commerce, BCom, MCom, and then pursue CA, chartered accountancy, they study commerce, economics, accountancy, application, relevance, foundation. Students who wish to pursue management, they study business accountancy, economics, management. Students who wish to pursue civil services, they study HEPS, history, economics, political sciences, social sciences, so on and so forth. In other words, every one of them have got a relevance and application, except one pre-professional curriculum, and that is all the students of 11th and 12th standard who wish to pursue medicine, dentistry, Ayurvedic, Unani, Siddha, homeopathy, BSc nursing, general nursing, BSc microbiology, genetics, and all the other BSc allied group of subjects, as we call them, BSc perfusion technology, BSc cardiac technology, so on and so. There's an endless list of them, including veterinary and agriculture, though not directly related. I'm just including it as a passing mention. These students, this group of students, they study physics, chemistry, botany, and zoology. The question that Medical Education Restructuring Curriculum would like to ask is, what is the relevance? What is the connection? What is, above all, the application of physics, chemistry, botany, zoology to medicine and allied group of subjects? The following points or the following questions are going to elucidate this point very clearly. What is the relationship between Young's modulus of elasticity and human digestive system? What is the relevance between classification of plant kingdom and human anatomy? What is the relationship between concave lens, convex lens, and metabolism of liver? What is the relationship between covalent bond and cardiovascular system? What is the relationship between Sandmeyer's reaction, which involves a primary aromatic amine and an aqueous mineral acid, and sodium nitrate, which leads to the production of a diazonium salt, and diazonium salt along with copper chloride, which gives rise to halide? What is this relation? How is this related to physiology of urine production? What is the relationship between spinal anatomy and Markovnikov's rule? What is the relationship between photochemical chlorination of isomeric alline, yielding simple isomeric monochloride, diisomeric monochloride, and triisomeric and tetraisomeric monochloride, and the treatment of typhoid fever? What is the relation? How does calculation of electrostatic force between two charged particles, spheres, that is the repulsive force of magnitude, using the equation F is equal to Q1 Q2 over epsilon naught pi r square, help a medical student in calculating the total amount of intravenous fluid that is required over 24 hours for a given patient who is suffering from dehydration or otherwise? How does the knowledge of difference between gymnosperm and angiosperm help in knowing the difference between respiratory asthma and cardiac asthma? How does the knowledge of cockroach anatomy help in the knowledge of human anatomy? How does the classification of animal kingdom help in understanding the process of digestion in the large intestine? What is the relationship between semiconductor diodes and human skeleton? We can go on like this, but I think beyond any doubt, I only hope that these questions have very, very clearly brought out and elucidated the point that there is absolutely no relation between physics, chemistry, botany, zoology, and human medicine and allied group of subjects. Having said this, we come to many questions and many perspectives. The first question that naturally would arise is, why is this system being continued? The answer is, from time immemorial, this is the system. That is why it is being continued. Nobody has questioned, nobody has raised a question. One. Second, society is resistant to change. See, any change is met first with resistance, and more than that, to bring about the change, it involves huge amount of work, brain work, physical work, leg work, paperwork, discussions, debates, arguments, counter arguments, governmental level, so on and so forth. This is all backbreaking work. Why should we do this? System is going on. Let it go on. 3. The students who are the main participants, they themselves have not raised this question thus far. So why should there be a change? So these are the main reasons why the system is continuing. Now, let us look at the disadvantages of this system. See, first of all, inapplicable quartet of subjects, namely physics, chemistry, botany, zoology, they are being studied. And after 2 years, at the end of 12th standard, the students write an entrance examination. On the last day of the entrance examination, what happens? These subjects are discarded to a corner. Never ever to be visited or utilized in the entire profession of medicine and allied group of subjects, allied group of professions. When they are not going to be utilized or going to be applied in the future professional course or in the profession for that matter, why do you study? Colossal waste of 2 years of precious academic time. Tons and tons of physical energy, mental energy, money, coaching classes, online coaching, teaching sessions, textbooks, so many things. Colossal waste. Another perspective. Suppose, a student doesn't get through NEET exam. That is, he or she doesn't crack in the first attempt, crack the exam. What happens? They go for a second attempt. What do they study? Physics, chemistry, botany, zoology. Higher physics, that is to say, higher standard of physics, go on polishing their physics, go on polishing their chemistry, organic chemistry, inorganic chemistry, botany, zoology, genetics, so on and so forth. Plant genetics, so on and so forth. In other words, these students are interested to join medicine and allied group of professions. Where are they going? They are going tangentially away. These are two divergent pathways. They are continuing to go, they will end up in a never-ending spiral of bettering their knowledge of, improving their knowledge of physics, chemistry, botany, zoology, only to crack an exam. They want to go to medicine. They are going in a tangentially different direction. The biggest disadvantage. Next, let us look at it from another perspective. Students who wish to pursue engineering, are they being made to study botany, zoology? No. No further discussion. Straight question, straight answer. Students who wish to pursue commerce, are they being made to study chemistry? Students who want to go to management, are they being made to study thermodynamics and physics? Then why is it that only students of pre-medical curriculum, as I would like to call, were they being imposed these subjects? Some of the protagonists of the present system, that is a PCBZ, they are going to say that no, these subjects from time immemorial, these have been introduced as a test of ability. That means to say, if these are yardsticks, tests of ability to crack the entrance examination, after which they can go. Physics, chemistry, botany, zoology, how do they serve as a yardstick for joining medicine and allied group of subjects? How does the inability of solving physics problems, chemistry problems, botany and zoology problems, how does that prove? The inability to solve these problems, how does it prove that the student is ineligible to join medicine and allied group of subjects? Is there any meaning? Again, the protagonists, the people who are going to raise questions. One more last question. That is, no, these physics, chemistry, botany, zoology, the aim of introducing these subjects is These subjects are meant to kindle an interest, KINDLE. They have been introduced so that they kindle an interest in the student towards medicine. So these 2 years, they will know whether they are going to they'll know whether they are going to have a leaning, aptitude and a liking towards medicine. Again the same question. Physics, chemistry, botany, zoology, semiconductor, diodes, diffraction, thermodynamics, optics. These are going to tell a student whether he or she is going to get interested in medicine, is it? Dentistry, medicine, nursing, allied group of subjects, veterinary, agriculture. Where is this? Where is this one-to-one relation? There is no relation. There is absolutely no relation. As a passing mention, I would like to state that I'm a 54-year-old cardiothoracic surgeon. I joined MBBS St. John's Medical College in 1988. Since then, up till now, have faith in me, there has been never ever even one single instance, the need or the necessity of using this knowledge of physics, chemistry, botany, zoology, roots, fruits, shrubs, xylem, phloem, nematoda, trematoda, gymnosperm, angiosperm, mollusca, arthropoda, crustacea, thermodynamics, radius of gyration, phenolic reactions, benzalkonium hydrochloride. None of this knowledge ever have I vouch for other doctors all across the nation. I can vouch for them. No application of this has ever been found in the treatment of human disease or in the subject or in the profession called human medicine, right from beginning up till the end. This is it. This is the foundation. This is how medical education restructuring curriculum opens the subject. So, having thus covered the entire gamut of questions, hopefully, naturally the viewers would like to ask, so what is it that you want to say? What is it that MERC would like to propose? Medical education restructuring curriculum would like to propose the complete removal of physics, chemistry, botany, zoology, the inapplicable, non-relevant quartet of subjects from the subject curriculum of 11th and 12th standard, and instead introducing human anatomy, human physiology, human biochemistry, and community medicine, also known as preventive and social medicine, in the 11th and 12th standard, calling it as 2-year pre-clinical sciences. Human anatomy, human physiology, biochemistry, and community medicine are nothing but the first-year MBBS subjects. In other words, bringing the first-year MBBS subjects into the curriculum, making the first-year subjects itself as the 11th and 12th standard curriculum, as I said, I repeat, as preclinical sciences, it is going to be one of the greatest revolutionary changes in the history of medical education, hopefully, God willing. This being the case, before we analyze this deeply, let us first look at the advantages of this proposal. Introducing of human anatomy, physiology, biochemistry, and community medicine in 11th and 12th for a period of 2 to 2.25 years. First of all, as I said, the removal of non-relevant, inapplicable quartet of subjects. 1. Secondly, students get to study those subjects what they have been wanting to study, what they have been longing to study. 2 to 2.25 years of precious academic time are now usefully harvested. 2 years of coaching, teaching, imparting of anatomy, physiology, biochemistry, and community medicine, preclinical sciences. It is something that is unimaginable. The students when they would be, God willing. At this stage, I would like to take a small break and mention something. I would be repeating it at certain intervals, and it is medical education restructuring curriculum is a proposal. I'm an ordinary citizen. I'm just an ordinary citizen, as we all are. Citizens in our nation, in this democratic setup, we only have the powers to propose, the freedom to propose a particular suggestion, curriculum, whatever it is, change. But the implementation, the incorporation, the agreeing to this proposal is always with the powers that rule our nation, namely the Government of India. Therefore, I repeat, this is just a proposal. This proposal has to be naturally ratified by many of the players, but above all, it is the Government of India and the related Union Ministry of Health or Medical Education or whatever it is. So, having thus mentioned as a passing mention, we now come to the advantages. As I said, the 2 years of these subjects, preclinical sciences, they are the foundation subjects. Anatomy, physiology, biochemistry, and community medicine, they are the most crucial, critical foundation subjects of MBBS. Normal human structure, normal human body functioning, biochemistry, the chemical basis of our human body, and of course, social medicine, community medicine, these constitute more than 33% of the syllabus. Once a student develops a very strong foundation in these subjects, his or her entry into MBBS, after having this, even before entering MBBS, once a student, if he or she gains this foundation, then the entry into MBBS is going to be super strong. They would already be ready. They would be prepped. They would have already studied, read, absorbed and assimilated this knowledge, and they would be directly ready for the MBBS course in the first year, where, of course, the advanced aspects of applied anatomy, applied preclinical sciences would be taught. That is a different story. We will come to that later. This is the biggest advantage. The other advantage is, today, in the present curriculum, these all-important subjects, the preclinical sciences, the academic course, the time period has been reduced to 1 year. I would like to, as a passing mention, say that even pharmacology, pathology, and microbiology and toxicology, forensic medicine, these are the second year subjects. These are known as paraclinical sciences. We will come to that later. Even these subject curriculum, the time allocated has been reduced to 1 year. In our times, it used to be 1.5 years and 1.5 years. At this stage, I, having studied 1.5 years of anatomy, physiology, and biochemistry, today I am neither afraid nor ashamed to say that if I am asked a question from any of these subjects, I don't think I can answer. The reason behind saying this is, despite having studied for 1.5 years, recollection, application may be there, but recollection, it is not going to be there. That being the case, today, with due respect to the authorities and the policy makers, they have evolved a formula of fast-tracking medicine. That means they are downsizing, they are cutting down the syllabus, and the time allocated is just 1 year. And they want to fast-track this and make sure that the students are going to enter into the clinical arena, that is a hospital scenario, in a slightly super fast manner. These students who have come from a background of physics, chemistry, botany, zoology, just for 1 year, the all-important foundation subjects, which constitute, as I said, 1/3, if they don't obtain proficiency in this, their entry into hospital scenario in a fast-track manner, that is not going to fetch the desired result. In a sketchy, tattered, with half-baked knowledge, these students are going to enter the second year or the hospital scenario. Anatomy, physiology, biochemistry, and community medicine, to put it in a numerical, to give a numerical example, numerical means when you look at it from a textbook point of view and a pages point of view, the sheer number of pages, the sheer volume, the sheer size of study material, it comes to close to nothing less than around 3,000 to 3,500 pages. 1 year, 365 days, Republic Day, Independence Day, holiday, so on and so forth. They might get 330 days. 330 days, 3,500 pages. Is it possible to read, study, master, understand, assimilate, absorb, and above all, recall, recollect, and apply it to the hospital scenario? It is not possible. Absolutely not possible. What is required is time. Leisurely, these important subjects have to be taught leisurely, diligently, with a beautiful division, organ system wise, as we shall come to later, and with, of course, a periodic exam schedule, unit tests, monthly tests, we shall come to that later. Only when such a broad platform, broad foundation is laid, only then will these students come out with complete knowledge of these important preclinical science foundation subjects, and then of course they can confidently start applying this knowledge as a part of applied anatomy, applied physiology, applied biochemistry, as we call them technically. That can then be fruitfully, then the objective of exposure to hospital scenario at an early stage. This is the philosophy of the policy makers. Their philosophy is not wrong. Their idea is not wrong. Their objective is not wrong. But the way of implementation, therefore, academic strategies have to have a very strong and a sound foundation. If that is not there, it will be a disaster. It will be a misadventure. Therefore, having thus explained, having thus put across the multiple advantages of introducing preclinical sciences, we will look at it from one more point of view. As I said, when a student doesn't get through the NEET entrance examination, he or she, in the present curriculum, tangentially, they go away towards more and more physics, more chemistry, more botany, and more zoology. Sorry for the word. There is nothing like more chemistry. I beg your pardon. As a person. In this, if God willing, if the government wills, if this is implemented, if a student fails, what happens? The student is not going to read or, sorry once again for the word, reread, re-prepare unconnected subjects. The student is going to, forgive me if my words are inappropriate, the student is going to gladly, all the more gladly, the student is going to read anatomy, physiology, biochemistry, and community medicine, which obviously will be the entrance exam subjects. Naturally, there will be the entrance exam subjects for MBBS if this is implemented. Again and again, I repeat. The student who has failed would read these subjects, and he or she would only become stronger and stronger. After having read for 2 years, 1 more year, if the student takes off to prepare, effectively, in toto, the student would have studied 3 years of anatomy, physiology, biochemistry. That is a huge time to master these subjects. That is the biggest advantage, one of the biggest advantages of this curriculum, if accepted, if implemented. Today, as a passing mention, when you look at the post-NEET analysis that comes out immediately in the evening, what is the standard? What is the bottom line? Physics was very tough. Out of 45 questions, we answered only 17 questions. Chemistry was of IIT standard. We were hardly able to answer 10 or 12 questions. Botany was very, very tough. Zoology was okay. Zoology was very tough, botany was okay. Students are failing left, right, and center. They fail. Why? Because they are not able to solve physics, chemistry, botany, zoology problems, questions as already mentioned. Out of 45 questions, they are hardly able to. Obviously, negative marking will be there. So, 17, 18 questions, 20 questions, 25 questions. So, it is a kind of a blame on the system. It is a kind of a blame. That means they are not able to, they are failing because they are not able to solve physics problems and chemistry, answer physics and chemistry problems in the entrance examination. Whereas, if preclinical science, anatomy, physiology, biochemistry, and community medicine are introduced, if a student fails, the question of blaming the system doesn't arise at all, because you have been given the subjects, you have studied the subjects that you want, that is relevant to medicine, that is medicine itself. So if a student has not performed, he or she only needs to polish their lacunae, deficiencies, and come back much stronger in that. That is another biggest advantage. So, having this outlined, there is one last biggest advantage of introducing APBC at 11th and 12th standard, and that is the inclusive nature of this curriculum. What do we mean by inclusive nature? Recently, a couple of years ago, in our nation faced a pandemic. Huge number of doctors were required, but there were deficiency of doctors. So, doctors from allied alternative medicine, namely the Ayurvedic, Unani, Siddha, and homeopathy system, they were also recruited. This is not a podium, or we are not discussing whether that is correct or wrong, or no, that is not what we are discussing. It is undoubtedly true that the alternative group of medicine doctors, they undoubtedly come from a different educational background immediately after 12th standard. True that they are being taught some amount of anatomy, physiology, biochemistry, etc. But having said that, it might not be as in detail as the MBBS group of students. The biggest advantage of MERC curriculum would be that no matter after 12th standard whether a student joins MBBS or alternative group of medicine, his or her foundation, whether he joins MBBS or BDS or Ayurvedic or Unani or Siddha or homeopathy or BSc allied group of medicines, BSc biotechnology, BSc microbiology, name it, they all will have one common foundation, and that common foundation would have been taught for 2 to 2.25 years. No matter afterwards, they can branch off into alternative group of medicine, Ayurvedic, Unani, etc. There will be a common foundation, there will be a common denominator, there will be a common educational academic foundation.